Thank you very much, Laura, for that kind introduction. And it might not surprise you to hear that my children don't really understand what I do all day anymore. When I delivered babies for a living, they used to understand that I was a doctor that helped the ladies with their babies. So my 9-year-old son, I was taking him into school the other day, and he said, "Mummy, you know this new job of yours?" I said, "Yes." He said, "It's all about keeping people healthy, isn't it?" A very serious voice. He sounded a bit worried. I said, yes, it's a good job. He said, "You're not going to ban sweets, are you?" So I said, "Everything in moderation, George. I'm not going to ban wine either." So I thought I would tell you a little bit about Scotland. I know that we have many international visitors here, and you're very welcome, and I hope you've enjoyed your trips to the various schools that you've been to, and will also enjoy some of Glasgow's hospitality. The last time, in fact, I was in this hotel was at my final year ball, as I was a Glasgow University medical student. It seems to have changed quite a lot, although that is quite a long time ago. So Scotland is a population of 5.2 million people. There are around 1 million children. Our budget for Scotland as a whole, the whole country's budget in total, is £37 billion. So that's how much we get from the UK government every year. And of that, 12 billion of that budget is for health. So almost a third is for health. And then the budget then that you're interested in, perhaps in this room, is 3.66 billion for education and a further 3.67 billion for justice, which you might say is when we get health and education wrong. We have 14 health boards, and it's not a coincidence that they're all covered in different tartan here, because in fact they work very autonomously. And so we've got quite a bit of variation in how we do things in Scotland, even in this small country. There are 8 support boards. Now that's NHS Education for Scotland, Healthcare Improvement Scotland. So other health boards that support the NHS. And we're really moving towards the integration of health and social care, starting with our budget being joint budgets between the NHS and local authority social care budgets, which started in April of this year. So we're a work in progress on that. So to give you an idea of size, this is Glasgow where you are at the moment, and the driving times on those red arrows are how long it takes to get to those far-flung parts of Scotland. And you'll see that right up at the top in Thurso is a further 2.5 hours further north. So although a small population, it's quite a large geographical area, and it's about 50% of the size of the land mass of England. So welcome to my world. And I'm going to talk to you about why getting it right for our unborn babies, because I, as the obstetrician, think that it's too late by the time we get it right for the child. So I'm going to talk you through why some of the developmental aspects of pregnancy lead on and find the foundation, really, for children for the rest of their lives. Time magazine picked it up. This is actually a few years old, this article. How the first 9 months shape the rest of your life. And we now know from epigenetic studies that the time in the womb shapes our response and our reaction to various stressors afterwards. So that the way that you adapt in the womb will change how your disease processes work out later in life. For example, if your mother has a BMI of 40, so obese during pregnancy, that child has a 5 times risk of dying from cardiovascular disease aged 50. Because we believe that the womb environment, that unhealthy womb environment, changes the DNA of that baby, so that when the baby is responding to cardiovascular stresses in later life, it adapts badly. And those children then are set up for a lifetime of less good health because of an unhealthy pregnant woman as their mother. So we now know that the developmental origins of adult disease stretch to all of these that we can see here. So in some part, our future health is held in that pregnant woman and in how healthy she is when that pregnancy is being gestated. So you'll see there's a hugely long list of illnesses, and the research into this now goes back around 40 years. So that even The Economist knows about this now, because of course this is massive economic importance as well. If we could get the health of the pregnant woman right, the health of that future baby right, and of course for you, as many of you in education, it's about getting those schoolgirls and schoolboys understanding that their health is important for them bringing up a future family. So you've heard already in this past 2 days about the health inequalities that we have in Scotland. So this is the rate of obesity in primary 1 children. The green line in the middle is all of Scotland, and the red line then at the top is our most deprived communities, with the blue line at the bottom is our most privileged communities. And you'll see that the rate of the prevalence of obesity since 2003 is rising very much, but rising very much in the most deprived communities. SIMD1, the most deprived, for those of you who know our Scottish index, and much more rapidly than it's rising across Scotland as a whole. And that's because the rate is falling in the most privileged communities. And those dotted lines then are predicted up till 2020. So that's not a very encouraging picture. And we know that this is actually just the east end of Glasgow, around about half a mile from here. And if I take you, you're in Central Station at the moment, so that the big round circle. If I take you to the left of the slide, up in leafy Hindland and Jordan Hill, very nice place to live. Probably some people in the audience live closer to that than they do to Central Station. And for each tube stop on the Argyll line, that purple line travelling east represents a 1.7-year decrease in life expectancy for men in Glasgow. So the leafy suburbs of Jordan Hill, males 75 years, females 83, and only 7 tube stops away, that life expectancy falls to 62 and 74. Literally, you're in the middle of those two lines. This is not geographically very separate. So we have our challenges, and I, as an obstetrician, wish that every couple, or particularly every dad in the antenatal clinic, looked like this. But unfortunately, I practice in Edinburgh and West Lothian, and they don't all look like this. They unfortunately look sometimes more like this, with the tartan shopping trolley and, of course, the ubiquitous cigarette. So why is it important, and why is it important that we understand all of this developmental information? So the first few years of life, 700 neural connections are made every second. And all of this is the most rapid time for all of this to happen. We will never gain that time of change and development ever again. And in fact, on my next slide, you'll see that before birth, minus 4 months, which I would of course call 20 weeks pregnant, you'll see that sensory, so hearing and visual pathways in yellow on the left, then language development, and then our higher cognitive function really takes off in pregnancy and accelerates right through the first few years, but see how soon it starts then to decline. And in the first year of life, you'll see that both the peaks of sensory pathways, language, and higher cognitive function occur. And then I'm afraid people like me are way off the scale. So we have had our opportunity to make the best of that brain development, and that peak is reached very, very early in life. So this is where I am on the scale over to the 40 to 50, and again you'll see, so the red line is the malleability, this flexibility of the brain. The brain is very plastic, both when the baby is a fetus in the womb and then for the first few months and years. But in order to try to enhance neural connections, that's the slope in the pink, look at the effort that's required. So all of that decrease in plasticity, the time is to really get the brain, the neural connections, stimulate those babies and children, because the effort required to get to the same level, as you can see, is very much more. And in fact, eventually the lines cross over and the deterioration is faster than you could possibly catch up. So, interactive influences and genes experience and shape the brain's capacity for change. And the brain's capacity for change decreases with age. Our brain is at the most flexible or plastic early in life. Cognitive, so that's how our knowledge is gained. Emotional and social capacities are inextricably intertwined throughout the life course. The brain is a highly interrelated organ, and its multiple functions operate in a richly coordinated fashion. Emotional, wellbeing, and social competence provide a strong foundation for emerging cognitive abilities, and together they are the bricks which form the life of the child. But toxic stress and damages developing brain architecture, which can lead to lifelong problems in learning, in behaviour, and physical and mental health. So a sobering thought that even before the baby is born, some of these neural connections are made that will never then be able to be undone with stresses, but also that the time for influence is within those first few months and years after the baby's born. So the first 1,000 days are critical, both prenatal and postnatal environment. The effects of maltreatment on development persist across the life course, and new genetic studies suggest that certain genotypes are a risk factor in adversity, but also confer resilience. So there's a lot more work going on in this epigenetic phenomenon, and I expect that to emerge very much over the next 5 to 10 years. So again, in my own world, we decided that the Scottish Patient Safety Programme, which I think you've heard about from Sir Harry Burns, my predecessor as Chief Medical Officer, Scottish Patient Safety Programme decided to have a maternity strand of it. So for the first time, we were focusing very much on some parts of maternity services that had been taken for granted. The stillbirth rate in Scotland, and in fact in the rest of the UK, had not changed significantly for around 20 years. And I, as an obstetrician, refused to believe that there was nothing we could do about that. I know that some of you are here from Holland, and the stillbirth rate in the Netherlands is around half of what it is in Scotland. So I was able to look at literature to see that other countries had a different stillbirth rate. So why was it not possible to achieve that in Scotland? So we set up a collaborative, and you've heard already about collaboratives of teams, multidisciplinary teams, people from different sectors, not just from health, working together. And we aimed to reduce stillbirths and neonatal deaths by 15% by 2015. One of the ways we were going to do that was to really tackle antenatal smoking, which I'll show you in detail is a big problem in Scotland. But when I stood up in front of an audience in a room a bit like this, my colleagues said, well, what do you mean 15%? There's a way we can change it by 15%. Where have you got 15% from? The stillbirth rate's the stillbirth rate. It's been like that for years. And I said, okay, maybe I'm wrong. Maybe 15% is unrealistic. Maybe I'll be proved wrong, but at least we can try. We can do a start. We can start. So maternal smoking is one of the strands of work that we're doing. We're also looking at reducing the incidence of babies born with growth restrictions, so that we're doing a lot more scans to pick up small babies and deliver them before they are then stillborn. Again, inequalities in maternal smoking. Around 20% of our pregnant women in Scotland smoke. Almost a third in the most deprived communities, and only 6% of the posh ladies. So the message has got out, but hasn't got to everybody, has it? And again, this is a discrepancy which outlines where I showed you on that tube map of Glasgow. And we know that smoking affects all aspects of pregnancy and beyond. It affects your ability to conceive, it causes miscarriage, it causes congenital anomalies, growth restrictions, stillbirth, and cot death. And we know that interventions work. We know that we can encourage pregnant women to give up smoking. They're 8 times more likely to give up smoking during pregnancy than at any other time in their lives, and that's because they're motivated to help the baby. Some of them then start smoking again once the baby's born. But this is a chance for us to really influence how women's health is. So now this is our graph of our stillbirth rate. So as I said to you, way back in this has got since 2004, so 10, 11 years of data on it, and you'll see that our stillbirth rate was 5.2 per 1,000 births, so around 1 in 200 babies was stillborn. And we started work on this in around 2010, but we really started our collaborative work in 2012, and you'll see that red line has changed. And when I put it on this graph, that green line at the bottom was our 15%. So I was wrong. because I wasn't ambitious enough. And it's actually fallen by 18% in 3 years. So there were almost 100 babies less, stillborn, less last year and the year before and the year before than there have been for 20 years in Scotland. So that's a real change. And that was taking something that we accepted as normal and accepted as something that was going to happen and refusing to believe that and doing something that made a real difference. So we're continuing to do that, and I'm boldly going to stand on this stage and say that 2015 is going to be lower still. But how can we tell that what we're doing is the right thing to do? How can we measure whether we're succeeding? So what I would put to you is that there are only 5 or 6 bullet points, 5 on this. Data, 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 and data. Because without the data, you're just another person with an opinion. So we have the shared vision of our early years collaborative in Scotland. And all of these children are holding something that they want to have, that want to have at the end of their time in education and in living in Scotland. So our aim is to make Scotland the best place to grow up by improving outcomes, reducing inequalities for all babies, children, mothers, fathers, and families across Scotland, to ensure that all children have the best start in life and are ready to succeed. Early Years Collaborative is that Scotland is the best place to grow up and the best place in the world to bring up children. And it's the first ever national multi-agency quality improvement programme led by community planning partnerships. So these work streams, and you'll not be unsurprised to hear that the one I like is this one at the far left, but we have all of these six work streams with the aim of having different groups of children influenced in a really focused way, as I illustrated with that stillbirth example, really focused using evidence-based interventions at each stage of their growing up. So Play, Talk, Read is one of our it's the 30 months to the start of primary school, and you'll see all of the statistics on this slide. And these slides, I think Laura is going to put on the website so that you can take some of these statistics away with you, because I know there's not time to read them all. So our website has had 103,000 visits, and you'll see that the different pieces of coverage and the different media and visitors to the site that has really taken off since that was launched. So we have our national outcomes, that our children have the best start in life and are ready to succeed, that we have improved the life chances for children, young people and families at risk, and that our young people are successful learners, confident individuals, effective contributors and responsible citizens. So Alfie likes his bedtime story because it helps him to dream. And these statistics are really about helping children, but also helping ourselves. So your child is 30 times more likely to laugh at something when they're with you. Babies learn to laugh before they learn to talk, to crawl or to walk. The more you and your little one laugh, the more likely you are to live longer. And a 3-year-old laughs 300 times a day. Something to aim for, isn't it? So I suppose I put it to you, as those of you who like Winnie the Pooh, here is Edward Bear coming downstairs, bump, bump, bump on the back of his head, behind Christopher Robin. It is, as far as he knows, the only way of coming downstairs. But sometimes he feels that there really is another way, if only he could stop bumping for a minute and think of it. So I challenge you to think about what you're doing and to wonder whether there's another way, and see if we can improve outcomes for our babies and children in health and in education. Thank you very much.